we're going to be doing a very, very important meeting sometime in the very near future on opioids in terms of declaring a national emergency, which gives us power to do things that you can't do right now.
That was President Trump, as he said, expected to make a big announcement, possibly as soon as tomorrow, on the nation's opioid crisis. It is a dire situation, summed up best in a sobering new piece from Dr. Sanjay Gupta. He said, "We find ourselves in the middle of an opioid epidemic that is the worst drug crisis in American history. It is a self-inflicted wound, and one that is predominantly made in America, as we consume more than 80% of the world's supply of opioid pain pills, even though we are less than 5% of the world's population. Many of those prescriptions have led to heroin use. 3 out of 4 new heroin users started with prescription narcotics." This comes on the heels of an explosive CBS 60 Minutes Washington Post report questioning Congress's role in the crisis.
I just don't understand why Congress would pass a bill that strips us of our authority in the height of an opioid epidemic in places like Congressman Reno's district and Congressman Blackburn's district. Why are these people sponsoring bills when people in their backyards are dying from drugs that are coming from the same people that these bills are protecting?
A week and a half after that report first broke, Congress is turning the tables. They are demanding answers from the DEA.
You've heard the frustration with this panel for not getting information we need from the DEA.
I am going to recommend to the chairman that we bring the wrath of this committee down on DEA.
I think that subpoenas may be really considered in this point.
Do I simply need to issue a subpoena because we are done waiting?
Joining me now, the chair of Energy and Commerce, who you just saw, Greg Walden from Oregon. He's joined by Don Flattery, who lost his son to opioid abuse, and former drug czar Gil Kurlikowski. Gentlemen, thank you very much, all of you, for being here today. Don, I want to start with you because the numbers that I just read for you, they are not just numbers. They are personal.
They are indeed. First, thank you for having me, and thank you for covering this story. They are very personal. If I could begin with a little bit of description of my son. My son is the new face of the addiction epidemic that's striking this country. He had all of life's and God's blessings. Was raised in a stable 2-parent family home. Attended an all-boys Jesuit prep school right here in Washington D.C. Was a great student and a graduate of the University of Virginia. He was a talented writer and filmmaker, and he pursued his passion in Hollywood. And while suffering from depression and anxiety, began self-medicating with a widely available prescription opioid, OxyContin. People like my son represent, in his journey, represent the new face of addiction because they are their losses and their lives. They are real people, and the public needs to understand that it's affecting a whole generation of people.
I mean, I think people are starting to understand that we're not talking necessarily in all of these cases about, people in inner cities, the way we saw the crack, epidemic, decades ago. This is such a different situation. Representative Walden, this argument that the DEA, that legislation was passed in Congress that actually impeded the DEA from closing down some of these pill mills in places like, small towns in West Virginia with hundreds of people in the town, and they've got hundreds of thousands of pills going there. Is that true?
Worse than that, no. In fact, in the hearing today, we showed the chart going back to 2011 where the DEA stopped using the authority they now say was taken away from them. They went from 65 cases down to 8 before the bill was ever passed. So we asked the DEA, tell us, if this is a problem, we'll change the law. There's no question about it. We ask everybody there, our duty is to go back and look at laws that have passed, which we were doing today, on all courses, say, what do we need to do as a team to get after this? Let me talk about West Virginia. It's a town of 400 people. 9 million pills went through there in 2 years. We have asked the DEA for months and months and months, who are the distributors? They said, well, we got to check it and see if there's a criminal case. Then they came back a month later and said, well, there's no criminal case.
Are they protecting these distributors?
I have no idea. I have fed up with it.
That's what the argument was on 60 Minutes, that they're protecting the distributors.
We're going to find out. And as you heard in the comments from the committee meeting today, I have the authority to issue subpoenas. I will do that if we don't get cooperation here. We should be on the same team. We're losing lives. His story is similar.
Pharmaceutical lobbyists that are causing this problem?
Not that I'm aware of. We'll find out. If they are, we'll go after them too. The issue here is, how do we protect the lives of innocent Americans? This is such a potent drug that people's chemistry changes. Yeah. Getting off of it is almost impossible. I had a round table with a very similar circumstance. A father who said, my son was injured in a high school football accident, got on there.
His son died that way.
And he ended up on heroin.
The other. Let me ask Gil, because you're a former drug czar for this country, you need to look at it from the big picture in terms of how to attack this. What's your advice?
So only one person actually in the entire administration can decertify a budget of any part of the executive branch, and that's the drug czar, along with the president and the OMB director. You bring in that position everybody together, Health and Human Services, the Department of Defense, the Department of Justice, to go after whatever the particular drug problem is. And that's the long history of this. It's important tomorrow to watch and listen carefully to the president's announcement. The treatment issue has to be fully funded. Without quality
treatment. When he says that
treatment,
if he makes it a national emergency, it will give them more power. Is that true?
There are some things that can be done. For instance, it also brings to the attention of the American public the crisis, as you just saw with Dr. Gupta. It brings that attention to the problem. But I think the treatment money, that's expensive, but we know that treatment works. We know that there are people all over this country that have recovered from opioid addiction and are serving, they're tax-paying good citizens. So, treatment.
Don, let me ask you, who do you think is central to fixing this problem? You know, when you sort of rail at whatever system this allowed this to perpetuate, who do you feel that towards?
I think there are multiple parties that are complicit in the anatomy of this epidemic explosion. Clearly and without question, the overprescription and overuse of opioid drugs for conditions for which they were never intended is directly implicated. Even today, despite considerable time, energy, and attention by health professionals, medical professionals, clinicians, and elected officials, the overdose statistics continue to climb in a very, very gruesome manner.
And you all know that doctors are incredibly sensitive to this suggestion that there is overprescribing. Now, we all know that most doctors have the best intentions and don't do this, but it only takes one place where you've got 9 million pills going through that someone is allowed to distribute those to.
So we need to get the answers to that. And the legislation we passed last year, different than what you saw in 60 Minutes, the CARA Act is designed to get at the issues you raised. For example, it used to be you couldn't issue a partial prescription, fill a partial prescription for painkillers, so you got the whole jar, right?
Yeah.
Now we allow partial. We set up all kinds of requirements to go in and look at best practices for pain management. The thing you have to be careful here is 27 million Americans also have chronic pain. We don't want to go so far that they can't be treated. You're a cancer patient. So we're trying to walk that line, but there's no excuse for
when someone has minor surgery, there's no reason for them to go home with 30 opioid pills.
That's exactly right. So we also need to be able to get those pills off the market, because a lot of what ends up in the black market is out of people's medicine cabinets, unused pills.
So true. Thank you very much, all of you, for your time and your energy, and we're sorry for your loss, and we thank you for the work that you're doing, Don.
Thank you for the show.
Thanks for being here.